All right. So for those of y'all just joining us, if you haven't signed into the chat already, if you'll sign in with your name and organization, so we have a record of you being here. I'm super glad everybody's here today. It's good to, I kind of see your faces, see some of your faces. And I am going to go ahead and open the floor for updates. So anybody who's got an event or activity coming up, anything you want to share, please feel free to share it. Also, take a look at the agenda. There are some activities and events on the agenda already for y'all to look at. So I'm going to open the floor. Anybody who's got something going on they want to share, go ahead and share it.
Hey, this is Gabby Smith with the Tennessee Commission on Children and Youth. I'm the Northeast coordinator, and we're having a domestic violence youth-related event. It's called Domestic Violence Through the Eyes of a Child, on October 24th from 9 to 2. It's a free event. If you are a member of the Northeast Council on Children and Youth, you're eligible to get 2.5 CEU credits for it. And if you're not a member and are wondering how to be, I can help you with that as well. We had put a cap on attendance at 55, but we've gotten a lot of interest on this specific training, so we've raised it up to 95. And right now we're sitting at a good 70. So if that's something that you're interested in, go ahead and register for it, please. And I'll put the link in the chat.
I'll go. My name is Shauna Johnson. I'm a health educator at the Carter County Health Department. And what we've done is we've partnered with the Carter County school system and the Elizabethton school system. Thanks, Emily. And what we're going to do is we're going to have a couple of flu-throughs that we're calling this year. So there'll be free drive-through flu vaccination events. We're going to have 3 of them this year. The first one will be on November 1st, and I'll attach a flyer in the chat for everybody. The first one will be November 1st from 9 a.m. to 12 p.m. at Elizabethton High School's parking lot. And that will be our annual Fight Flu event. And then we'll have another event geared towards our parents, our teachers, and students that want free vaccine. And the first one will be November 2nd at Hampton High School. And that will be from 4 to 6 p.m. And then that following Thursday on November the 7th, we'll have another flu through at Elizabethton High School parking lot again. And that will be from 4 p.m. to 6 p.m. as well. And all you need to do is pull up. You don't have to get out of your car or anything. Keep in mind, though, if you are bringing kids age 0 to 17, they must have a legal guardian, present in order for them to receive the vaccine.
Did you all hear my update, or was I talking to myself on mute?
We heard you.
We heard you, Gabby.
Okay, good. I looked down and it said it was mute. I was like, oh, great. Thank you.
So Shauna, just to clarify, these flu clinics are open to the whole community or just open to the school system?
No, ma'am, they're open to the whole community and they will be free events.
Hey, Shauna, are you looking for volunteers?
We already have our health department staffed out. I think we've got it covered.
Okay, good.
Thank you.
Mm-hmm. I'll go next then. Hello, everyone. My name is Kathar Elksir. I'm a third-year doctoral student at ETSU. Public health. I'm doing community and behavioral health. I'm currently working on my dissertation, and I'm trying to assess the level of knowledge and awareness of Northeast Tennessee Health Council participants when it comes to radon and lung cancer in Northeast Tennessee. I'm just going to drop the link to my REDCap survey if you don't mind taking a minute and answering the questions. If you already taken the survey, you don't mind to, you don't have to take it twice. I don't believe someone will like taking the survey twice. Towards the end, it's gonna ask you to provide your email in case you wanted to win a free radon test kit. So if you provided your email, you can enter a lottery to win a radon test kit. And then at the end of my study, I aim to come back and provide the study findings by county. So please provide me with your zip code, because at the end, like I said, I'll be back and present it by county level. So it's really important to hear from you. Thank you so much.
I'll go next. This is John Knack with Creekside in Kingsport. We continue to expand at Creekside, where you've got the roof and shingles on our 24-bed expansion. So we'll be the largest crisis stabilization facility in the area. We'll have 96 beds. We're 24/7 walk-in, free assessments, avoid the ER if needed. We just rented 6,000 square feet in a building right next to us for our outpatient PHP and IOP. If anyone has any questions, my name and information's in the chat. Thank you.
Anybody else have updates before we move into our speakers?
Yeah, hi. So I'm Chelsea with Appalachian Mountain Project Access's Health Insurance Marketplace team. And I just wanted to let you all know that open enrollment for healthcare.gov does start on November 1st. So we're going to start scheduling appointments and letting people know about our extended hours here within the next coming weeks. So if you have anybody that needs assistance with Health Insurance Marketplace or even TennCare, just feel free to shoot me an email. I posted it in the chat and we'll get them in.
Hello, this is Ashley Arnold with Tennessee Voices Survivor Connection Program. So we are still accepting referrals at this time. There's no wait list. And one of the individuals that work on the team is bilingual. So we also take Spanish speaking clients. So if you have any questions, my information is in the chat. Thank you.
Hey everybody, this is Rachel Dean with the UT Extension Office. I just had an update about a program that we are offering at the library in the next upcoming about 2 months. It's called Stay Strong, Stay Healthy. It's a physical activity program geared towards building strength and balance in older adults. It's free, weights are provided, and that's going to be at the library starting next Wednesday at 1 o'clock, and it'll be on Wednesdays and Fridays. So if you have any questions, please feel free to contact me or Marianne at the library.
Hey, I have an announcement. I'm Emily.
Hello, my name is Esme Guevara.
Oh, sorry.
Go ahead.
Sorry, can you hear me? I'm with Elizabethton City Schools, and I just put a form in the chat. Sorry, somebody else already sent a survey. But I have a short little form survey as well. The reason why I'm sending this out, it should only take you about 2 to 3 minutes to answer. But Elizabethton City Schools is establishing a family resource center this year. We haven't had one with Elizabethton City Schools. This is just a very brief needs assessment to kind of get us some data as we're starting this process to basically see if you all are aware of a family resource center and what it is, and you're willing to collaborate with us as community partners. So if you don't mind to please fill that out, that will just help us get some data as we get started, get an idea of community partners that we can work with so we can connect our families and our students to all those resources. We will do, as we get established, we'll do a presentation during the CCC meeting so you can kind of see like our plan and our priority areas. But thank you for your participation in that.
All right, I'll go next. Again, my name is Esmeralda Guevara. I am with Tennessee Voices with the FAST program. We have recently made the move or the transition to start serving Carter County. I will include the flyer, and there's no waiting list. I am bilingual, so services can be provided in English and Spanish. If you have any questions, my contact information is in the chat. Thank you.
Okay, well, we will go ahead and move into our speaker portion of the meeting. We have 2 speakers today. So our first one is Victoria Runyon with UT Extension, Carter County. They do a lot of amazing things in our community, and I'm super grateful to have them in our community and for Victoria to be sharing with y'all today. So I will turn it over to Victoria.
Wonderful, thank you. Will you make me a co-host so I can share my PowerPoint?
You should be good.
Can everyone see my PowerPoint?
Yeah, we can see it.
Yes. Okay, I'm gonna go forward and then back. Everyone can still see it. Sometimes it gets frozen, so.
Yeah, looked like
Okay.
it worked.
Awesome, perfect. Hello, everyone. So I'm Victoria Runyon, and I work for UT Extension in Carter County. So a little bit about me and my extension experience. So in the summer of 2022, I was an intern in Washington County, and I got to see different aspects of nutrition, agriculture, 4-H. And then I began in my current role in September of last year. So I've been here for about a year. I do have my associate's degree from Northeast State, and my bachelor's degree, I graduated this past May in, my degree is in agriculture. I have a few pictures of my dogs here. So what is Extension? It is a nationwide organization. Many states have Extension, and they all offer services. Extension in Tennessee is unique because it is in all 95 counties, and there's several counties where it's a joint effort between UT and TSU. So about our office, we have an administrative assistant, Kathy Button. So she does reporting, input, data, and she is our primary contact if you come into the office. We have an agriculture agent. Her name is Kathleen Wilson. She offers services and programs like soil samples, BQAs, TAP. So anything like farm and plant related, she can help you with. Then our 2 and 4-H, our agent is Roger Clark, and our program assistant is Grace Shown. They offer in-school clubs as well as out-of-school clubs, projects and contests, and camps and conferences for 4th grade through 12th graders, and also judging teams like forestry and wildlife. Family and Consumer Science, our agent is Rachel Dean. So she has programs and services like she was mentioning, the Stay Strong, Stay Healthy, Matter of Balance, Grandparents Raising Grandkids, and Food Preservation and Canning classes. So I also fall under the Family and Consumer Sciences as TNCEP. So I offer indirect, direct programs for youth and adults, so from pre-K all the way through adults. So what is TNCEP? TNCEP is a grant through the USDA called Tennessee Nutrition and Consumer Education Program. So here are some of my youth programs that I have. They, like I said, start in pre-K or preschool, like Color Me Healthy, and then go all the way to 12th grade, like the Teen Cuisine here. So they talk about the My Plate, how to be healthy, exercise, and eat well. One of my favorites and some of the class favorites are making tracks with Rudy Raccoon. So I have a puppet of a raccoon. And so since most raccoons eat trash and stuff, we're teaching Rudy how to eat healthy. So they seem to really like that one. Some direct youth programs that I'm currently doing or have done in the past and plan to do like over the summer. So I'm in several schools this year, the Boys and Girls Club, the Elizabeth and Carter County Public Library. Last month we had a food art program that I did with Ashley, and that was a lot of fun. And the small children, they made butterflies with different food art. Teach Co-op here in Elizabethton, and then the Elizabethton Housing Development. Here are my adult programs that I have. The most popular one that we do is the Eating Smart and Moving More, Eating Smart at Home. It's 8 to 10 lessons, and each session is 45 minutes to 90 minutes. All of these are wonderful. They're, promoting eating healthy and exercising and involving your family. Here are some of the places that we do programs at currently. The Bridge to Shore Homes, the Elizabethton Senior Citizen Center, the Courtyard Apartments, Elizabethton Housing Development, and the Elizabethton Carter County Public Library. We finished a program at the library at the end of September, and I will be beginning one in, I believe, the beginning of November as well. So we'll be doing some different crock pot recipes with the My Plate. Some indirect and partnerships. So I have events like these, which are coalitions, but I can also go to events and set up a table and give out some incentive items or a food taste for everyone to try. I recently went to the Overdose Awareness Day event. I believe that was my most recent one. So set up a table and give out some flyers about water and eating healthy. So my goals and expectations for TNCEP each year for direct adults education is 75 enrolled and 50 graduated. Youth, it is in groups instead of individuals. So 25 groups enrolled and 18 graduated. And then indirect, like these, are 6 events per year. So some personal goals and expectations that I have are, of course, to meet those expectations. I would like to do some more direct programs, especially with adults. Those are the ones with the series, typically at least 4 series. And then since the students is in groups instead of individuals, I would like to meet with 500 plus students. Some of my resources that I use, so we use the myplate.gov, and then our website where you can find out more information about agriculture, 4-H, and family and consumer sciences is carter.tennessee.edu. Here's my contact information as well as our office number. So if you have any questions, feel free to ask them now and I can answer them for you.
Is there an income limitation for this, or can anyone participate?
We are geared towards SNAP qualifying individuals, but we will also accept anyone that will come to the programs. I'm going to stop sharing my screen. Okay, there we go. Any other questions? Thank you for your question.
Yes, I know I partnered with UT Extension with Rachel to offer some classes to our students, Elizabeth and City Schools, like the after school program. Are you the contact person that I would contact now for something like that, or Rachel?
Yes, it would be me or Rachel, but yes, depending on the program, either one of us could do it.
Okay, awesome. Just making sure.
Yes, we work together.
Yes.
Perfect. Thank you.
Do you have a flyer or something that we could share?
Yes, I have a list of my programs, and I will get those together and I'll link them in the chat, or at least send them through an email. And it just says what the programs are, and it'll have our contact information on them.
Okay, thank you.
You're welcome. All right. Thank you all.
Thank you so much, Victoria. I will go ahead and turn it over to Tyler, our second speaker today. Want to definitely say thank you to Tyler and to everybody for their hard work on this data package that he is getting ready to share with us. It's a big deal, y'all, and it is beautiful information, and it's something that I think will benefit all of us to have and really benefit our community. So I'm grateful for everybody that came together to make this happen, especially grateful for Tyler and his team for putting it together and all the work that they did. So I'll turn it over to Tyler, and he's going to share it all with you.
Hello, everybody. Can you all hear me okay?
Yes, we can hear you.
Yes, we
Okay,
can.
awesome. I just want to echo the same thing that Jillian was saying. Just a huge thank you to everyone that took part in this process. I know it was a massive undertaking, but it's going to be well worth it. We got a really comprehensive and very useful data package put together that I'm fixing to show you. But again, thank you to everybody who was part of this process, who asked your friends, neighbors, patients to take part in the survey, did focus groups. This looks really good here. So I'm going to share the PDF in the chat for everybody. Download that, use it to your heart's desire, use it for grant funding, use it to, inform decision making in the county, right? Just show people data metrics. I'm going to walk you through the whole package. I'm not going to go super in depth just because we don't have a whole lot of time and there is a lot of data to cover, but just to kind of show you what we're going to be doing with it. We did a strategic planning meeting a little while back to kind of figure out where we're going with the CCC, and in the data committee, we're going to be focusing on getting this out to as many community partners as possible, and then also creating kind of like a one-pager infographic about this, or a brochure about the CCC that will include some data points from this that are, like our top three from this, top three issues. So that's coming down the pipeline. We're looking maybe like 2024 for that. But for now, this can be used however you need, and we'll redo this process in another 3 years. But I will go ahead and share my screen. Okay, can everybody see that okay?
Yes.
Okay, excellent. I'm actually going to stop my video because this is a lot on my computer. So, the first page is just our title page, a table of contents if you need to pick something out pretty quickly. And then we go into a brief introduction to the collaborative, what the county health assessment is, kind of data that we collected from it, the benefits of doing a county health assessment and a county health improvement plan. That's that CHIP part, which is what we're doing as a strategic plan. Next, just gives a background of Carter County history. So just history of the county, and then we go into description of the county. So, what are some railroads, interstates, parks, stuff like that make up the county. And then some county health rankings data. Then we get into demographics of the county, age, sex, race and ethnicity, household income. And we decided to include an industry and economic development piece. So what does the industry in Carter County look like? Where are most of the jobs at? And then we get into kind of per capita income, breaking that down, employment rate, poverty level. You can see that broken down between all the Northeast counties besides Sullivan. So we're just covering our Tennessee Department of Health Northeast region there. Next is educational status. So background of the school systems in Carter County, both the county and city school systems. So we have a breakdown of the school, students, teachers, the ratio, and the grades there. And then here's it is for the city school. And then you have a little piece about educational attainment, school dropout rate. And then we move into predominant health facilities in the county. So Sycamore Shoals Hospital, Charlotte Taylor Center, Health Department, and Roan Medical Center, and then Medical Care PLLC were some of the ones that we included. And then we get into health indicators. So this next bit, I'll kind of scroll through pretty quickly, but each of these health indicators is an indicator pulled from our survey that we distributed. So we wanted to have a secondary data piece metric for each of the questions we asked on our survey. So that way we had hard data from peer-reviewed sources, as well as our data about perceived risks around those issues in the county. So you'll see each of our survey questions here. This is the secondary data. So these are your hard data points. And you can find all kinds of good, helpful information here for, say like grant writing. Like I said, I won't spend too much time on this. A lot of graphs. We tried to keep the worded information as little as possible, just really descriptors for each graph. See, I'll scroll through this. And like I said, all of these data points are from peer-reviewed government websites, census data, Tennessee Department of Health data. I know the CCDP included some data with us as well. So this was not just random Google searches. Let's see. Yeah, and then a really interesting part here is we asked about stigma, and stigma itself is not an easy metric to kind of gauge, right? So we did two different kind of looks at it, where we did stigma around WIC and SNAP enrollment in the county, and then we also did recovery housing, and you can see that broken down by sex in the county, so the population versus beds available, and also breaking down the recovery meetings per population in the county. Crime rate. Let's see. And then we get into our health assessment, right? So I may slow down a little bit here, but the introduction to the county health assessment, what we did, how we did it, breakdown of the survey, focus groups, all that stuff, methodology, and then the results. So you can see kind of the demographic results that we got. Majority of folks taking the survey were 30 to 39 years old. Majority were female. Most folks had a high school diploma or GED as the highest form of educational status they had. 94% of participants were white. Income status, we had a lot of folks in the less than $25,000 a year range, and a lot from the $25,000 to $50,000 a year range. And then we get into our survey results. Each of these has been kind of grouped into kind of major health indicators. So physical health and fitness indicators. So under that, we have youth weight management, adult weight management, and physical activity. And you can see those broken down by not a problem, minor problem, or major problem. Next, into substance use and addiction indicators. These were some of our largest indicators rated as major issues. Next is maternal and child health indicators, teen pregnancy, infant mortality, immunizations, behavioral and mental health indicators, youth poor mental health, adult poor mental health, and suicide, educational attainment and literacy, so ability to read at a third grade reading level, high school graduation rate, healthcare and public health indicators, diabetes, heart disease, preventable hospitalizations, cancer, access to healthcare, and then stigma, or seeking help or resources there. Socioeconomic and public health indicators, unemployment, average annual income, crime rate and incarceration, domestic violence / teen violence, negative childhood experiences, quality of life, housing, transportation, access to parks and greenways, community water fluoridation. And that was all of our basic survey questions. So next we have a breakdown of survey participants by area and zip code. So you can see where most of the individuals taking the surveys came from. So Elizabethton and the JC Elizabethton area, Roan Mountain, Hampton, Butler, all those, for a total of 371 completed surveys. 5 of those surveys were in Spanish that were completed. We did have a write-in portion where folks could kind of write in other topics that weren't covered in the original survey base. So we see homelessness, cost of living, lack of education, substance misuse and abuse, built environment, distrust / anger toward local government and politics, lack of resources, and healthcare. So those were our top write-ins during the survey. Then we get into our qualitative data. So our listening sessions, we did 6 of those. I want to thank Julian again for helping put a lot of those together. Well, pretty much all of them. Bridge to Shore Recovery, Recovery Resources, Carter County Collaborative Group, an LGBTQIA plus group, a senior group, and a youth group. And down here, it just breaks down all of that data that we collected from the listening sessions. So we kind of grouped answers. So maybe not everybody said substance misuse specifically, but the answer that they gave was substance misuse related around like top 10 issues, barriers, assets. And then some more questions are listed here along with the top answers to those. Next, we pull out our top 10 issues. So ranked, these were our top 10: substance misuse, fatal and non-fatal drug overdose, youth nicotine / vaping use, adult weight management, adult nicotine / vaping use, adult poor mental health, babies born dependent on substances, youth poor mental health, domestic violence / teen violence, and negative childhood experiences. So among those, we'll pick out our top 3 to focus on as the collaborative. So those would be substance misuse and abuse, adult obesity, and mental health. Next is just picking out those top 3, a little bit more in-depth discussion about those in the county, a conclusion, and then everybody who worked very closely on this. And that's our health assessment.
Tyler, that's awesome. Thank you guys for doing all that. That's incredible information.
Yes. And like I said, I shared it in the chat. Please feel free to share with as many folks in the county as possible. I'm also going to be sending this out in the Carter County weekly reminders, as well as the post-meeting communications for a long time, just so it's on everybody's radar for a while. And just continue to share and help everybody out by utilizing the data, right? And if you have any questions about the process or want to talk to me any more in depth about the data package or what's going on with it, please feel free to reach out to me. And I will expect, I know some of our folks in here are regional partners. Most of the other counties are not going to be finished until maybe December or beginning of 2024. Carter County was the guinea pigs. Y'all did amazing. Y'all have the most surveys collected in the region. So I want to thank everybody, like I said, for being the first to go with this process, and it looks great.
Tyler, did you say you put it in the chat?
I did. I can reshare it.
Yes, please.
Give me 1 second. All right. Just reshared it in the chat. Alrighty, y'all. Thank you so much for your time. I appreciate you all.
Thank you, Tyler. Okay, so we are going to move into our breakout committees now. I'm going to ask each of our breakout committee or our subcommittee leaders to share a little bit about their committee. So we have exciting news. We, in our strategic planning meeting last week, we talked about adding back a second committee, that committee B that we have struggled with in the past. And so Gabby has graciously committed to leading that second committee. So if I can have Tia share a little bit about Substance Use Committee, what you guys are doing today, anything you want folks to know about your committee. Same thing, Emily, if you'll share with Data Committee, and then Gabby, if you'll also share about the new committee and maybe some of what your goals are in case people want to join y'all as well.
So today in Committee A, the Substance Use Committee, so we're going to kind of talk about different events going on in the area. And we really try to focus on how we can bring different resources to these events. And so we're going to kind of bounce back and forth with some ideas today.
Do you want, I guess I'll go ahead and go next for our committee. We're the assessment committee. Like we said, we've been working on the strategic plan. So we're gonna go over all of the goals that we came up with in our meeting last week and make sure the whole committee is on board, and continue looking at that. Just so all the committees know, with our strategic planning process, we are probably gonna rework and rewrite our mission and vision for the entire Carter County Collaborative. So as you're looking over the strategic plans in your committees, if anybody has any suggestions or a new wording for our mission that you want to share, just let us know and we'll get that worked out.
Okay, so this is Gabby. I'll tell you guys a little bit about kind of the vision we have with this new committee. As we were looking at the community health assessment, kind of the needs, we know that substance misuse is a huge problem in Carter County, and we have a whole wonderful committee for that, but there are a lot of things that kind of fall outside of that scope. So we kind of grouped together and looked at what was left over that didn't have anything to do directly with substance misuse disorders. We're calling it the Carter County wide subcommittee, which stands for Wellness, Inclusion, Diversity, and Equity subcommittee. So this is just a subcommittee that kind of helps to target things outside of what the substance misuse committee will be doing. So some area of concerns that we pulled straight from the community health assessment are things like adult weight management, adult poor mental health and youth poor mental health, adverse childhood experiences, domestic violence and teen violence. And then we have something, for example, like baby born with parents, or babies born with parents, two parents, I can't talk today, obviously, two parents with substance misuse disorders, which is something that we could collaborate with our other subcommittee, but it kind of goes beyond just that. So it's kind of a catch-all for some other things. We made a big long list of other things that were of concern to us as we've worked in this region. But if there are other things that you want to share with us in that, this is kind of a place where I know in my previous role with human trafficking, that's a very specific topic, and it didn't really fit into some other subcommittees fully. So this would be kind of a catch-all for that. And as we move forward, I mean, this first subcommittee meeting is just to kind of establish where we want to go from here. And I know there's going to be 10 million different things that we all want to target. So we're going to try to kind of narrow down what, maybe a top 2 or 3 priority for the next year, or however long we have to come up with a plan and kind of map out those goals, and just kind of focus on a few things at a time so that we make sure we're not, getting spread thin or doing too much at once. So.
Okay, thank y'all so much for all sharing. I'm going to go ahead and open all the rooms now. Y'all are welcome to join as you wish. And when committees are done meeting, y'all are free to go. We will see you next month.
And I
Thanks for being here.
I added the strategic plan working document to the chat so everyone can look at our draft.